Hello, my name is Kaylee Kramer, and I have question number 2 from Chapter 1 in homework number 1. My question is how disruptions in normal microbiota can lead to infection. I will now explain what we will be covering in this presentation in the exact order. First, we will talk about the foundational knowledge about normal microbiota. This will include the definition, the purpose of normal microbiota, and the locations that they are within the body. Second, we will talk about what happens if normal microbiota is disrupted. This will include talking about opportunistic pathogens, process of infection, and I will also give one example of how normal microbiota can be disrupted to cause an infection. Let's begin. I know what you are probably thinking. What even is normal microbiota? Well, I have to tell you, it's pretty important for your body in a good way. Normal microbiota are communities of bacteria which act as microbial ecosystems. In other words, they are good communities of bacteria for your body. They colonize in your body during birth or following birth. What do they do for our bodies? They are good for training your immune system. As a review, your immune system fights off infection. Keep that in mind. Your immune system fights off infection, and normal microbiota are good for it. One small disruption to your normal microbiota will not be a good ending. As we will learn later in this PowerPoint, it can cause types of infections and even diseases. Now, let's keep on talking about our foundational knowledge of normal microbiota before we enter into disruptions. So, where is normal microbiota located in the body? There are many locations in the body that normal microbiota are found. Let's talk about 4. They are located in the skin, which is seen mostly in moist areas such as the groin area in between the toes, respiratory tract, which is usually the nose, urinary tract, or digestive tract, which is seen in the mouth and colon. So, what happens if our normal microbiota is disrupted? First, when your normal microbiota is disrupted, your immune system is now out of whack. Now, because of your immune system being disrupted, an opportunistic pathogen will now establish an infection. The opportunistic pathogen is pathogenic, which usually occurs after a disease, wound, or infection. One example of a disruption to the normal microbiota is, let's say a patient comes in with a skin infection from a sty in their eye. The opportunistic pathogen would be Staphylococcus aureus, which creates an infection. This infection can then become active and have a chance of worsening. Now, let's finally overview and conclude our thoughts on how normal microbiota can lead to infection. Normal microbiota are communities of bacteria that function as their own microbial ecosystems. They are located in various sites throughout the body. When normal microbiota is disrupted, opportunistic pathogens will create an infection. One example being Staphylococcus aureus. The opportunistic pathogen will then disrupt the normal microbiota by creating an infection that can then worsen. Thank you.